Namaste. Best wishes for healthy heart. Today's world heart day. As you know, the heart diseases are increasing and the incidence is going up in our country. Previously, we used to think only in Western countries there are more heart diseases. But now in India also, not only coronary artery diseases, other still congenital heart disease incidence is increasing because early detection. Likewise, still rheumatic heart disease problem is there because still housing wise and this nutrition wise still we are behind. If you see the types of heart disease, there are congenital heart diseases which come in the childhood or they may present in the late in adult age. And also rheumatic heart disease, usually they will be affected in between 12 to 20 years with rheumatic fever and streptococcal infection in the throat, which may present at later stage after 20 years. Because we are not taking preventive measures, this rheumatic heart disease burden is still there in our country. Congenital heart disease we can prevent if we take advice by gynecologists during pregnancy, at least to some extent. Whereas as rheumatic heart disease, early detection and prevention by penicillin will take most of the rheumatic fever. It can be prevented. Coming to coronary artery disease, this is major burden in our country. The incidence is going up because of diabetes, hypertension, smoking and obesity, and also lifestyle differences in our country. The lifestyle, mainly sedentary lifestyle, and also our working conditions added to this increased incidence in the coronary artery diseases problem. These are modifiable diseases, risk factors like smoking, diabetes, hypertension, and obesity. Whereas some other factors like lipidemias and other causes, familial causes, we cannot prevent. At least by modifying and leading a disciplined life, we can prevent this coronary artery disease to some extent. Everyone will confuse between the valves and vessels which supply blood to the heart. Valves are inside the heart. There are 4 in number. They are in between the two chambers are one chamber and great vessels of the heart. Whereas the vessels are on the surface of the heart and they are supplying blood to the heart to do its function, like pumping the blood into the circulation. So many people will get confusion whether stenting is better for coronary artery disease or coronary artery bypass surgery is better. Stenting can be done if the 1 or 2 vessels are affected, that too discretely, small area. Whereas coronary artery bypass surgery is useful in patients with diffuse coronary artery disease and also proximal, we will call it a left main disease. In those cases, coronary artery bypass surgery is essential and it will prevent their symptoms and heart failure.